To consider if you're thinking about starting a carnivore diet on your favorite GLP-1 medication, Semaglutide, Tirzepatide. If you're new to my channel, hi, I'm Dr. Jones DC, a holistic obesity expert that specializes in sustainable weight loss, and I work with like-minded medical practitioners where we utilize interventions, lifestyle interventions to focus on the underlying mechanisms behind obesity and help our patients wean off the meds and maintain their weight. A carnivore diet is a very aggressive and radical diet where you basically only eat meat, and you can't just eat steaks and our favorite types of muscle meat, but we also have to get a lot of organ meat. And what the proponents say is and speak of is amazing health benefits. And a lot of controversy exists because what about fiber? What about all this other nutrients that you may not get? And some of them say that you are going to get nutrients. This is not a video to be pro-carnivore or not. These are just things to consider, especially if you're taking GLP-1 medications. Number one, expect rapid weight loss. GLP-1s cause rapid weight loss. Carnivore diets cause rapid weight loss. You are combining two powerful weight loss methods, so pay attention to that and enjoy. Number two, you're going to have to actually eat more, and you're probably going to have to eat more than what you comfortably are desiring to do so. Otherwise, you're going to crash really fast, likely with a weight loss plateau, which happens from sustained caloric restrictions. Carnivore diet is highly satiating. GLP-1s cause a lot of fullness. Be careful and force yourself to eat at least 2 of those 7 days per week, if not 3, spread throughout the week. Number 3, ask yourself, why are you doing this? Because carnivore diets, like I said, for some people are wildly beneficial, but are you just doing it because you're curious, or do you have one of the conditions that would warrant it? Well, what would warrant it? Again, the literature isn't clear, but we know autoimmune cases, funky, weird GI-related issues, all sorts of health conditions. And this is funny when it comes to the functional world, but if you've gone through the gambit through medical, allopathic, standard medicine, and they've been able to tell you you're fine, but you're not, generally we're talking about autoimmune related conditions, and it could be autoimmunes that are lesser known and not more commonly known. If you find yourself in that situation, I totally respect your decision to want to start an experiment with a carnivore diet. It's kind of nice because when you look at restrictive diets, those you might think would be easier to do because you're not as restrictive. But when you get super restrictive, it actually becomes more confusing and overwhelming and just easier to say, here's what I can eat, meat and organ meat. I totally get it and I respect it. And like I said, for some people, it can be magical. Just understand that it is very unlikely to be sustainable for the overwhelming majority of you. And so don't expect or set yourself up for something that's very unlikely to be sustainable. I don't even maintain a keto diet myself, nor do I recommend that to patients. And for us in our weight loss program, where we utilize Tirzepatide, AOD 9604, powerful fat mobilizing peptides, we don't recommend a carnivore diet or even a ketogenic diet because it's not sustainable. We have to look at interventions that we honestly can say, I think I can do that for the rest of my life. And when you look at keto and you look at carnivore, it's not likely. We are very strategic, and we only ask our patients to start with maybe 6 weeks or so of keto, and then we cycle it in and out so that we can allow for a comfortable lifestyle that I think is important and vital for long-term success. Hence the name of my book, Fast, Feast, and Flourish. If you guys haven't checked it out, it's on Amazon. If you guys want to learn more about our approach, we have a 94% success rate, and we guarantee results, not just short-term, but long-term results as well. Click the profile icon, scroll to the top. There's some resources there. You can schedule a free consultation, guys. And as always, stay safe, stay healthy out there.